Welcome to Oncology Podcast News. I'm your host, Ellen Baker. This week's top stories include prostate cancer treatment may increase heart disease. Men with prostate cancer want treatment rather than having to wait, but with a litany of side effects. Drug Avastin can slow brain tumors, and anemia drug may not be for every cancer patient. In our top story, androgen deprivation therapy for prostate cancer may increase the risk of death from heart disease in patients over age 65. The study that was based on data from CAPTURE, a national registry of men with prostate cancer, was presented at the Prostate Cancer Symposium held in Orlando. Prostate cancer growth is thought to be due to circulating androgens or male hormones. Androgen deprivation therapy, or ADT, is a treatment where drugs are given alone or in combination to either block or reduce the level of androgens. ADT is found to decrease prostate cancer. Drugs such as leuprolide acetate, or Lupron, goserelin acetate, or Zoladex, flutamide, or ulixin bicalutamide, or Casodex, or nilutamide or Andron are commonly used for ADT. However, according to a study by researchers at Dana-Farber Cancer Institute in Massachusetts, ADT is associated with increased body fat deposits, diabetes, and elevated body mass index, all of which raise the risk of death from heart disease. The researchers compared the number of cardiac-related deaths among 735 men with localized prostate cancer who received ADT and among 2,901 men whose treatment did not include ADT. They found that the longer the patients received ADT, the sooner they were likely to die from heart disease. Further analysis showed that the link between ADT use and death from heart disease was significant in patients over age 65, but not in those under 65. After 5 years, 3% of older men who received ADT died of cardiac causes, compared with only 0.9% of men who did not receive the therapy. Moving on to our next story. Every year, about 219,000 men develop prostate cancer, and 27,000 die from the disease, according to the American Cancer Society. Most prostate cancers grow slowly. While aggressive cancer needs to be treated, there is controversy in the management of a slow-growing type. Surgery and radiation treatment can cause pain, incontinence, and impotence. Some physicians prefer treatment as soon as the cancer is diagnosed. Others feel that most men with low-risk disease do not require immediate treatment. They prefer the watch and wait approach. They argue that the older men with slower growing cancer may die of other causes long before their cancer creates problems. However, a recent study at the Prostate Cancer Symposium showed that few men are comfortable with the watch and wait approach. In the study, 310 of the 1,886 patients were eligible for the wait and see approach, yet only 28 patients, or 9%, chose surveillance. Older men were most likely to wait rather than undergo treatment. Those over 70 were 26 times more likely to wait compared to patients under 63. In other news, Avastin, one of the targeted therapy agents, can slow the growth of brain tumors known as gliomas. Researchers showed that when Avastin is given in combination with chemotherapy, you can temporarily stop the growth. Researchers from Duke University tested Avastin together with the chemotherapy drug irinotecan in 32 patients with stage 3 or 4 gliomas. They reported that 63% of the patients had their tumors shrunk. The tumor did not grow back for 6 months in 38% of the patients. According to the American Cancer Society, 18,000 people are diagnosed with gliomas in the United States each year. Stage 4 gliomas is very aggressive, with very few living beyond 3 months, and chemotherapy usually slows the growth for just 6 weeks to 3 months. The brain tumor is difficult to treat because many chemotherapy drugs cannot reach the brain. Avastin is a member of one of the new family of drugs called targeted therapy. It starves the tumor of the blood supply by inhibiting the formation of new blood vessels. Avastin is marketed by Genentech, and its chemical name is bevacizumab. And finally, the U.S. Food and Drug Administration recently announced that the drug darbepoetin may cause increased mortality in cancer patients with anemia. Darbepoetin, marketed by Amgen as Aranesp, is one of the growth factors given to cancer patients who develop anemia while receiving chemotherapy. Darbepoetin is said to reduce the needs for blood transfusion. Physicians also give the drug for anemic cancer patients who do not receive chemotherapy. However, researchers recently reported that the drug caused increased deaths among cancer patients. The study was performed on 989 cancer patients who have anemia and are not receiving chemotherapy. The researchers also found that the drug did not reduce red blood cell transfusion requirements in these patients. Thanks for listening. For Oncology Podcasting, this is Ellen Baker.